So you finally said it out loud. You're thinking about retiring overseas. And then someone leans in and says the scary thing. You know Medicare won't cover you over there, right? And just like that, the whole dream feels like it might fall apart. Here's the good news. That sentence is true, but it is nowhere near the whole story. And what happens next to your healthcare is something you actually get to decide. Hi, I'm Haley. Welcome to my channel, Travel Elements, where I cover travel tips, international living, investment insights, and so much more. And today we're tackling the single biggest fear I hear from people dreaming about a life abroad. What really happens to your Medicare? And how do you not go bankrupt if you get sick in another country? So here's exactly what we're going to do together. First, I'll walk you through all 4 parts of Medicare, A, B, C, and D, and show you what each one does and does not do the second you step outside the United States. Then we'll tackle the big decision everyone gets stuck on. Do you keep paying for Part B or drop it? Because there's a trap hiding in that choice that can cost you for the rest of your life. After that, I'll show you the 3 real ways people actually cover their healthcare overseas with real 2026 numbers. And then near the end, I'll tell you the one catch that catches almost everyone. The thing about pre-existing conditions that nobody warns you about until it's too late. And look, I want to be upfront. This is the part of moving abroad where a wrong guess gets expensive. Not oops, a few dollars expensive. We're talking thousands of dollars a year, sometimes for the rest of your life, just because nobody sat you down and explained how this actually works. So let's make sure that's not you. And just so we're clear, I'm sharing what I've learned from digging into this, not giving you medical or legal advice. Your situation is your own, so please check the official sources and talk to a qualified advisor before you make any final calls. Okay? Okay. Let's start with Part A. That's your hospital coverage. The big inpatient stuff. Hospital stays, skilled nursing, hospice. Here's the first thing that surprises people. For most Americans, Part A is free. You already paid for it through payroll taxes during your working years, so there's no monthly premium. So the question of whether to keep it is easy. You keep it because it costs you nothing. But, and this is the catch, does it actually cover you abroad? No. Outside the United States, with only a few rare emergency exceptions near the border, Part A does not pay for care in a foreign hospital. So you've got this free hospital coverage sitting in your pocket that does nothing for you the day you're living in Lisbon or Cuenca or Chiang Mai. Keep it because it's free and it's there for you if you ever come home. Just don't count on it for a single day overseas. Now, Part B. This is your medical coverage. Doctor visits, outpatient care, lab work, all the everyday stuff. And this is where the real decision lives. Because unlike Part A, Part B costs you money every single month. In 2026, the standard Part B premium is $202.90 a month. And just like Part A, it does not cover you abroad. So now you're staring at a strange choice. Do you keep paying over $200 a month for coverage you literally cannot use in your new country? Hold that thought, because this is the trap I promised you, and we're going to walk through it carefully in just a minute. Next up, Part C. That's Medicare Advantage. These are the all-in-one plans from private insurers that bundle your coverage together, often with extras like dental or vision. And here's the thing people get wrong about these for living abroad. Medicare Advantage plans are built around a local network in a specific service area back in the States. Move out of that area, and moving to another country definitely counts, and the plan basically stops working for you. Most of these plans will actually drop you once you've been outside the country for 6 months. Some of the PPO versions include a little emergency travel coverage, which is nice for a short trip home. But as your everyday healthcare in your new country, a Medicare Advantage plan is not the answer. If you have one and you're moving abroad for good, that's a plan you'll likely be leaving behind. And finally, Part D, your prescription drug coverage. And honestly, this is the simplest one of the bunch because Part D covers nothing overseas. Zero. It will not pay for a single prescription you fill at a pharmacy in Mexico or Portugal or Thailand. Part D plans require you to live in the US just like Advantage plans do. Now here's a small piece of good news that surprises people. In a lot of countries, the medications that cost you a fortune back home are dramatically cheaper out of pocket. So losing Part D abroad often stings a lot less than it sounds. But on paper, the answer is clear. it does not follow you. Okay, I want to put this all in one place for you because this is the part you'll want to remember. So here's the simple truth about all 4 parts the moment you leave the country. Part A, hospital. Does not cover you abroad, but keep it because it's free. Part B, medical. Does not cover you abroad, and this is the one you have to decide on. Part C, advantage. Does not work abroad and usually drops you. And Part D, drugs, covers nothing overseas. 4 parts, and not one of them truly follows you. Pause it, screenshot it, keep it handy. So now let's go back to that trap, because this is the decision that keeps people up at night. You're looking at that Part B premium, and the obvious thought is, well, if it doesn't cover me over there, I'll just drop it and save the money. And honestly, on the surface, that sounds completely reasonable. But this is exactly where people make the mistake that haunts them for years. Here's the math on keeping it. $202.90 a month every month comes out to about $2,435 a year for coverage you can't use while you're abroad. That's real money, and I'm not going to pretend it isn't. But here's what happens if you drop it. If you ever move back to the United States, and a lot more people do than expect to, you have to re-enroll in Part B. And Medicare hits you with what's called the late enrollment penalty. It's 10% added to your premium for every full year you went without it. And this is the part that gets people. That penalty isn't a one-time fee. It is permanent. You pay it every single month for the rest of your life. Let me make that real. Say you live abroad for 7 years and you dropped Part B the whole time. You come home. That's a 70% penalty stacked on top of your premium forever. In 2026 numbers, that turns a roughly $200 premium into about $345 a month for life. So the savings from dropping it can quietly turn into one of the most expensive decisions of your retirement. So how do you actually decide? It really comes down to one honest question. How sure are you that this move is permanent? If you are absolutely certain you're never moving back, some people are, and that's completely valid, then dropping Part B can genuinely make sense and you skip paying for something you'll never use. But if there's a real chance you'll return for family, for health, for any reason, a lot of people choose to keep Part B as an insurance policy against that penalty. Think of it like this. You're not paying for healthcare you can't use. You're paying to keep the door home open without a lifelong tax on walking through it. And here's my honest take. If you're newly abroad and still figuring out if this life is forever, keeping Part B through that test phase is the cautious sleep at night choice. You can always drop it later once you're sure. And hey, if this is already making the murky stuff clearer, do me a quick favor and hit subscribe. I make videos like this every week for people building a life abroad, and I'd love to have you along. Okay, let's keep going because knowing what Medicare won't do is only half the answer. The other half is what actually replaces it. So if Medicare doesn't follow you, what covers you in your new country? There are 3 real paths people take, and the right one depends on your country, your budget, and your health. Let's walk through all 3. Option 1 is international private health insurance. These are global plans built specifically for expats, companies like Cigna Global, Allianz, GeoBlue, IMG. The big advantage is that they travel with you, they're renewable year after year, and many of them will even cover you on trips back to the States. For a 65-year-old, a solid international plan generally runs somewhere between $150 and $300 a month, depending on where you live and how much coverage you want. Want it to include coverage inside the United States too? That can push it higher, sometimes 30 to 50% more, because American healthcare is the most expensive in the world. This is the most flexible option, and for a lot of expats, it's the backbone of their whole healthcare plan. Option 2 is local private insurance, a plan from an insurer right there in your new country. And this is the one that genuinely shocks people, in a good way. In a lot of popular retirement destinations, local private coverage costs a fraction of what you'd pay in the US. We're talking about countries where a private plan and out-of-pocket doctor visits are so affordable that some expats honestly just pay cash for routine care and carry insurance only for the big emergencies. The trade-off is that a local plan usually only covers you in that country. It won't follow you home or to other countries the way an international plan does. But if you've truly settled in one place, local insurance can be the best value on the table. And option 3 is the public healthcare system of your new country. This is the one Americans almost never see coming because we just don't have anything like it. In many countries, a lot of Europe, parts of Latin America, and Asia, once you're a legal resident, you can actually enroll in the national health system, sometimes for a very modest contribution, sometimes nearly free. Portugal, Spain, France, Costa Rica, these systems are real, and they're often excellent. The catch is you usually have to be a legal resident first, and there's often a waiting period before you're fully in. So it's rarely your day one coverage, but it can become your long-term foundation once you're settled. Now here's something that ties all of this together, and it surprises almost everyone. Even if you decide to lean on a public system eventually, nearly every retirement visa in Europe requires you to show proof of private health insurance to get in the door. Take Portugal's D7 visa, the famous retirement visa. To get it, you have to show private coverage valid in Portugal before they'll approve you, even though you can register for their public system later once you're a resident. Spain's non-lucrative visa is the same story. Private insurance, no copays, full coverage required up front. So the lesson is this. Private insurance isn't just a backup plan. For a huge number of you, it's literally the key that unlocks the visa in the first place. You cannot skip it. And now the catch I promised you at the very beginning. The one that catches almost everyone, and the reason I really wanted to make this video. It's pre-existing conditions. Here's the reality. More than 9 out of 10 adults over 65 have at least one chronic condition. Diabetes, high blood pressure, a heart history, the everyday stuff so many of us live with and manage just fine. But to an international insurer, those are exactly the things they look at hardest. And here's how it actually plays out. Many of these plans will either charge you more for those conditions, make you wait before they'll cover anything related to them, or in some cases, exclude them from your policy altogether. So you could buy a beautiful international plan, feel totally covered, and then discover the one condition you most needed help with is the one thing they carved out. This is why you never, ever wait until the last minute. The single smartest move is to lock in a good international plan while you're younger and healthier, and keep it continuously. Because some insurers stop taking brand new applicants at 65, 70, or 75 anyway. And whatever you do, be completely honest on your application. Hiding a condition feels tempting, but it's the fastest way to have a claim denied when you need it most. Disclose everything. Find the insurer that treats your condition fairly, and they do vary a lot. And you protect the exact coverage you moved abroad to have. Okay, let me pull this whole thing together into one simple game plan you can actually act on. So here it is, the whole video on one screen. 1. Keep Part A, it's free. 2. Decide on Part B based on whether your move is truly permanent, and respect that lifetime penalty. 3. Pick your replacement, international, local, or public, based on your country and your health. 4. Line up private insurance early, both for your visa and for your pre-existing conditions. Take a second right here, pause the video, grab a screenshot, because this is the checklist you'll actually want when you sit down to plan your move. Everything we covered, right here in one place. And remember, these numbers and rules reset every year, so always verify the current figures before you act. So now I'm curious about you. Which part of this was the one keeping you up at night? Was it the Part B penalty, the cost of replacement coverage, or that pre-existing condition worry? Drop it in the comments because I read them, and honestly, your questions become my next videos. Well, that brings us to the end of today's video. I really hope this took something that felt scary and overwhelming and made it feel like a decision you can actually handle, because you can. If you got something out of this, do me a favor and like this video and subscribe to my channel so you don't miss what's coming next. I post new videos regularly. And if you know someone who's dreaming about a life abroad and worrying about exactly this, send it their way. It might be the thing that finally makes it feel possible for them. And let me know in the comments if there's a topic you'd like me to cover next, and I'll do my best to make it happen. Until next time, take care of yourself and keep that dream alive.